Yep, go ahead.
Okay.
Okay, my name is Jillian. I'm going to be demonstrating the mini bag IV with the vancomycin. I'm going to start by checking my MAR against the doctor's orders. It's for vancomycin. It's going to be at 50 milliliters per hour with a drop factor of 20, so it's going to be 17 drops per minute. Some of the side effects of vancomycin can be ototoxicity and Redmond syndrome. So I'm going to begin by drawing up the vancomycin. Clean this off. I'm going to draw up 10 milliliters. So this is going to be my 10 milliliters. And I'm drawing up 10. Okay. And then I'm going to insert this into the mini bag. I'm going to clean off the port here and insert that in. Okay. And just mix it up nice and good. I'm going to put my label on there. It's going to have my client's name, what drug it is, the dosage, the time of the administration, and my initials. And then I'm going to get my saline ready. I'm again going to clean the saline off. I'm going to drop 6 milliliters. Okay. And I'm going to have that ready for when I want to go into the room. Okay, so then I'm going to get the line ready. I'm going to get this prepared. This is all sterile, brand new. I'm going to insert that in there all the way. Okay, and then I'm also going to label the line with my initials, the date and the time. That right there. Prime the line. Okay, fold that back up and attach my alligator clamp. Okay, so now I'm ready to go into the room. I'm going to start by asking my patient their name and their date of birth. I'm going to explain the procedure that I'm going to be hooking up their antibiotic to their IV site. Ask if they have any questions, if they're okay with me doing that. And if so, I'm going to start. I'm going to check, before I check anything, I'm going to wash my hands and put on my gloves. And then I'm going to check the site for any pain, heat, edema, or erythema. Everything looks good, so I'm going to go ahead and begin. I'm going to start with my saline solution. Clean the port. And with a stop and go every half milliliter, about 3 milliliters of saline solution. Okay, and everything looks good. So then I'm going to go ahead and hook up my line. Clean this off again. Okay, and I'm going to make sure it's set at 17 drops per minute. Check it against my watch. Yep, that's 17 drops per minute. That's awesome. It's going perfectly. So I'm going to take off my gloves, wash my hands, leave the room, check back periodically to make sure everything's going okay. When it's scheduled to be done, I'm going to re-enter the patient's room, wash my hands, put my gloves back on, a new pair of gloves, and I'm going to detach the bag, and I will put on a new alligator clamp for next time, and I'll go back with my saline, clean the port, and flush it with the last 3 milliliters. And I will get rid of my sharps in the sharps container. Everything looks good still, so I'm going to, and also I'm not going to use heparin unless it's ordered by the doctor. And I will be documenting now what medication I use, the time, the date, the route of the medication, and the volume of the fluid that came off of the MAR. And that's it.